Hey guys, gals, and non-binary pals. Healthcare has become a hot-button issue for the country right now. The left is saying we need government to fix it, while conservatives are pushing for less government in healthcare. But before we talk about either of these solutions, we need to take a step back and ask, what's even wrong with the current healthcare system in the US? Well, to put it simply, a lot is wrong, and a lot of it is due to government. There's a lack of competition, and it's really expensive. The most expensive healthcare in the world, actually. Because our healthcare system is so broken, people are quickly choosing sides, and the left is starting to go to the Medicare for all, or single-payer system option, where the government pays for everything. On the other hand, the right is actually moving to get government out of healthcare, partially or even entirely. So, in this video, we're going to compare and contrast single-payer and free market systems. If you're going to criticize, at least watch the whole video, and as usual, all my sources will be in the description. But before we start talking about healthcare, we need to actually define what we're talking about. Single-payer or Medicare for all in this context is a healthcare system in which the government controls and finances all healthcare costs through taxes. Contrasting a free market healthcare system in which private healthcare providers and insurance companies compete for quality and price, just like businesses. Now this is where most leftists say, we have extremely high prices in the US, the companies are ripping us off. The free market has failed, and it's time for government to try healthcare. But this is misleading. Yes, healthcare is really expensive here, and that's a problem, but the free market doesn't normally do that. When left alone, prices actually go down, unless there's something preventing competition, like the government. But what exactly has the government done? Well, let's start with Obamacare, aka the Affordable Care Act. Now, before I get attacked by leftists, I will give them this. Obamacare did get more people insured. It's not what it did, though. It's what it didn't do. Lower costs. A lot of people know about the US's exploding healthcare costs. But what a lot of people don't know is how Obamacare actually affected these costs. Well, the bill says that all medical devices will be taxed at 2.3% of its price. That means in order to compensate for the loss from taxes, medical device manufacturers had to make their devices cheaper and less advanced. This hurt the medical industry and made them produce less. There are also a myriad of other taxes on medical care providers I won't go into right now because there's way too many of them. In addition to taxes, the bill introduced requirements for insurance plans. This literally made cheap health insurance plans illegal. It only allowed the expensive plans, which covered all of these benefits. So, if you're a young person who just wants a plan that covers catastrophic accidents, you currently can't get one under the ACA's requirements. The government is forcing you to take the expensive option or the uninsured option. This didn't just hurt customers, it also hurt the medical industry. Because businesses have to cover so much, it pushed the small businesses out of the market, leaving only the big guys. Obamacare eliminated competition, which combined with all the regulations and taxes, left only a few companies. Competition is the main force which drives prices down. Without it, there is nothing to stop the rise of prices. Now, there is still the argument that the US should adopt a single-payer system. After all, virtually all democratic nations have it. If they do it, why don't we? Well, it's not as good as it's put out to be. And countries like France and Germany have private insurance companies. Countries with actual single-payer systems are Canada, the UK, and Norway. In my first video, I went over some of the downsides, but I only briefly covered it. I'm not just going to copy and paste from my older video, though, so I'll just paraphrase what I said. Overall, according to the Commonwealth Fund, the US has faster treatment times than Canada and the UK, both of which have single-payer systems. This includes emergency services, specialist treatment, and non-emergency care. And the UK is barely holding up. The NHS isn't doing well, as several articles state, like this one, and this one, and this one from the BBC. Anyways, the US in terms of treatment isn't actually doing that bad. As I said before, we have quick treatment, but not only that, we have high quality treatment for those who actually get care. Now, I've seen a lot of leftist arguments, so I'm going to predict someone's going to say, that's not true at all. Look at the life expectancy, the mortality rates. America has a huge obesity problem. So many people die from respiratory diseases. Well, you're not wrong. You're just misleading. Because diseases like obesity are caused by self-care, how people take care of themselves. And Americans are not really health conscious, at least generally. So to make a fair comparison, we need something that is purely or mostly based on the quality of hospital care. How about cancer mortality? Well, the US cancer mortality rate is actually below average in the developed world, according to the OECD. Where are the UK and Canadian single payer systems? They're above average, here and here. But numbers and data aside, can healthcare even be considered a right?
Access to affordable health care should not be a privilege, it should be a right.
Well, health care is a basic human right, and I will fight for basic human rights. That
means health care is a human right.
Well, first we need to understand what constitutes a right and what constitutes health care. Let's start with rights. Fundamental human rights are universal. They are not tangible, and they're something every human has. You always have them, regardless if you're stranded on an island, buying coffee in Starbucks, or if you're a convict in prison. They're universal. Governments do not give you rights. However, I am sure a leftist might argue that the US Bill of Rights just debunks my argument. And you'd be wrong. Governments can recognize rights like the US, or infringe on them like Nazi Germany. The Bill of Rights is just the US promising not to make laws that infringe on your rights. They do not give you these rights. Now, some of these rights are simple protections like the right to say what you want as long as it's not a call to violent action against someone or a group, or just the right not to be killed. Healthcare, on the other hand, is a product and service. You can't have a right to healthcare because healthcare does not universally exist, nor is it infinite. You are not born with healthcare. If you're in nature, you don't have healthcare. If you're in nature, you have the right not to be killed and to speak freely. But for the sake of argument, let's just ignore everything I said and say that the government actually does give people rights. Well, I'd say most, if not all, healthcare requires doctors. Doctors are people. So if healthcare is a right, then you literally have a right to force people to treat you despite compensation. In other words, you have a right to slaves. A right to slaves in itself is a paradox, completely ignoring the definition of a right. You can't have a right to slaves. That's just absurd. So if you truly want high quality and affordable healthcare, you should be in favor of helping the free market, because it promotes innovation, drives costs down, and actually generates funds for our government via taxes, instead of taking trillions each year from your pocket and the pocket of your neighbors, friends, and family. And yeah, I think that's it for now. Anyways, sorry this video took so long to make. I've been busy with summer school, and this is a very complex topic to research. I spent an hour looking through the ACA bill, which is actually in the description. If you enjoyed, maybe consider liking the video, and if you didn't, be sure to tell me why in the comments. I always encourage political discussion. I've kind of had a roadblock in ideas though, so if you got any suggestions for what to do in the next video, just leave a comment. Thanks for watching and stay informed.